Welcome back to our Health Mobile app series. LucidQuest analysed 14 therapy areas in the second half of 2025 and provided rankings of top apps by downloads and by our proprietary LQ score. For full rankings and insights, download the complete report. Let's explore the highlights. Alzheimer's disease and dementia app ecosystem is dominated by cognitive training and brain game apps focused on general brain fitness rather than disease-specific support, with limited scientific referencing and few validated interventions. Arthritis apps primarily focus on pain tracking, symptom diaries, and daily self-management, using medical language but offering mostly high-level evidence and limited clinical integration. Cardiovascular disease apps form one of the largest and most crowded ecosystems, centered on heart rate, blood pressure, ECG, and wearable monitoring, yet largely remain tracking tools rather than decision support solutions. Crohn's disease, IBD, and ulcerative colitis apps operate in a small, medically framed ecosystem emphasizing symptom, diet, and medication tracking to support self-management rather than ongoing clinical oversight. Diabetes apps reflect a relatively mature therapy area built around glucose monitoring, insulin tracking, and lifestyle management, with strong daily integration but limited automated treatment adjustment. Hemophilia apps exist in a highly specialized ecosystem focused on infusion and bleed tracking, with strong credibility but minimal innovation beyond logging. Kidney health and nephrology apps focus on lab values, dialysis scheduling, diet and medication tracking, yet offer limited disease stage personalization and clinical workflow integration. Major depressive disorder apps occupy a broad, consumer-oriented landscape centered on mood tracking, CBT-informed exercises, and self-help content, with limited formal validation or mental health care integration. Migraine apps are condition-specific tools focused on attack logging, trigger identification, and medication use, showing relatively strong credibility but remaining largely tracking-based. Multiple sclerosis apps form a small, specialized ecosystem addressing symptom, fatigue, and relapse tracking, though most remain patient-led with limited clinician-facing functionality. Oncology apps across multiple indications span education, symptom support, treatment organization, and survivorship, but largely function as supportive tools rather than integrated care components. Parkinson's disease apps primarily support symptom and medication tracking, with minimal integration into care pathways. Psoriasis apps are mainly used for flare tracking, photo documentation, and treatment adherence, while validated outcomes and treatment optimization features remain rare. Respiratory disease apps are clinically framed around asthma and COPD monitoring, inhaler use, and spirometry-related features, yet mostly follow a track and report model without proactive treatment optimization. Across therapy areas, the app's ecosystem is mature in tracking but underdeveloped in clinical integration, validation, and outcome-driven intervention. To access complete rankings, validation data, and strategic insights, download the full LucidQuest report. Contact us at info@lqventures.com for expert insights, and don't forget to like, share, and subscribe for more updates.